Under what circumstances can a minor legally provide consent for a medical treatment without parental consent? So a minor is anybody usually under the age of 18, depending on where you're working. So this is like a child or a teenager who's not yet 18. So 18 or below. And usually when you're a child, depending on certain situations like this question's asking, a parent would need to consent. So when we're talking about consents to procedures, informed consents, as we've seen in other questions, usually the patient would be providing that for themselves. However, if this is a younger patient under the age of 18 years old, the parent would be doing that for them. But there are certain situations where there's loopholes to this, and that's what we're looking at in this question. So let's look at the choices. Option A is saying when the minor is at least 16 years old, and generally speaking, you have to be 18 to give consent. Maybe certain topics, it could be a little different, like if we're talking about like giving birth or things involving more of those sensitive topics. Sometimes there's different rules depending on what exactly we're talking about. But generally speaking, when it says a patient's at least 16, in general, over 18, 18 plus is considered adult to make decisions for themselves in just a general context. So we can eliminate option A. Option B says in emergencies when delay could endanger life. And that would be a good example of a time when they could make a consent for themselves in an emergency situation. So an example of that could be if an ambulance gets called for, let's say, a teenager. Let's say they're around 15, so they know what's going on, and we're trying to get in touch with the parents, but no one's able to reach them, and this is a life or death situation. We would want to consider the fact that this is an emergency, and it's implied that the parents would want to save the child's life over everything. So in that situation, we would consent on their behalf, even though the child is under 18. So this is an example of when we could get consent without parental agreement. So option B would be correct, but let's see what the other choices have to say here. Option C says, for any treatment the minor deems necessary. And no, not for any treatment. The parent would have to consent for them if they're under 18, under just general situations. So we can eliminate option C. And then option D says when the treatment is very inexpensive, and that's not relevant to when a minor could make consent for themselves. So we'll eliminate that. And then that leaves us with B, in emergency situations that could endanger life. Other situations to consider, if a teenager gives birth to a child, so like a teenage pregnancy, then they are actually considered to be emancipated from their parents, and then they can make decisions for themselves and the child, because now they're assuming that parental role. So something to keep in mind in case that comes up in a question like this. Similarly, if you have a 17-year-old making decisions regarding sexual health, that usually, depending on where you're practicing, but sometimes they could make consents for themselves in those situations as well. So just things to consider if you see another question around these types of guidelines. But in this question, the answer is option B.